So it is my pleasure to introduce a fellow COO in the development field. She is going to talk about innovation in global health. Don't just make it work. Let me introduce my new friend, the Chief Operating Officer of Gradian Health Systems, Erica Frenkel.
I'm going to start today by telling you the story of my proudest moment working at Gradian and this anesthesia machine, the UAM, which was designed to work without electricity or medical oxygen. Surprisingly, it's not the story of the very first machine we ever installed, which that photo shows. It's not the story of the first baby I saw born from an emergency C-section that was made possible because this machine was in the hospital. It's not even the story of the first surgery I observed where the power in the entire hospital went out, and this guy kept working as he was designed to do, enabling the surgery to continue. These are all obviously amazing moments and why I love my job as much as I do. But the story I'm thinking of is from 2014. One of these guys was installed in a children's hospital in Uganda. And one day, something broke and it stopped working. And it was that day that I came to appreciate a different side of innovation in global health, one that goes far beyond this technology that so often gets the attention. You see, the machine broke on a Friday, and by Monday morning, our locally trained technician had traveled to the hospital equipped with the right skills, the right tools, and the right parts, and he had it up and running by that afternoon. Simple story. And later that week, I got a call from the head of the organization who had purchased the machine for the hospital. And he went on and on about how frequently he saw medical devices break in the hospitals across Africa that he had worked in. And when they did, no one knew how to fix them. They got pushed to the side, no longer able to treat patients as they had been designed to do. And here I was expecting him to be mad at us for the same reason. We're just another one of the same. But instead, he marveled at our immediate and successful response time and asked to buy 5 more machines for neighboring hospitals. Now think about that. He bought the first UAM because it was designed to work in a challenging hospital like his in Uganda. He bought the next 5 because he saw that we had the systems in place to make sure that it would continue working in such a challenging environment, and he knew that was rare and critical. And I love this story because it illustrates a broader truth about innovation. It is not enough to design a shiny new gadget that we can throw at a problem. We need to spend equal or more time adapting our operations, building our businesses around the environment in which that gadget needs to work. For Gradian, that truth has become our raison d'etre. Gradian is a nonprofit social enterprise that harnesses the power of medical technology to unleash human potential and drive game-changing improvements in the way healthcare is delivered in some of the poorest places on the planet. Now, when we were starting, we thought we might become a more conventional design firm. We'd follow up our first product with a steady stream of new ones each year, similarly able to treat patients in low-income countries. But we quickly learned that our ability to have an impact hinged on a different design challenge. How do you make a product thrive in an environment characterized by limited funding, limited human resources, and incredibly weak health infrastructure? And when we looked around, the stories and statistics bore out this reality that there weren't a lot of people focusing on this issue. Estimates of up to half of all medical devices in hospitals across Africa are broken and out of use, pushed to the side to an equipment graveyard, as we call them, like this one behind me, that every hospital has. Maybe they needed a $5 part that's not available in their country. Maybe the user's manual showed up in Chinese, but the users speak Swahili, so they never knew how to use it to begin with. Or maybe the person who knows how to fix this product is based in Europe, and it's just not an option to fly him out every time a repair is needed. Now, this is unimaginable here in New York. I am due to have a baby in a few months, as you may be able to tell, and I am stressed about a lot of stuff. But I am not worried that I'm going to show up and when the time comes and the hospital is going to tell me, I'm sorry, we can't treat you. Our equipment isn't working today. It just wouldn't happen. But for countless patients across the markets we work in, this is a painful reality. And it is an intolerable one for us at Gradian, which is why we became a company that focuses on putting the people and services in place to meaningfully support fewer products so they can be successful and save lives. So what does that mean? Well, because most of our hospitals don't have staff dedicated to maintaining the equipment, we have trained and certified technicians in each of our markets to install our products, to maintain them each year, and to fix them when they break. And because all machines break, we've ensured that those technicians have local inventories of replacement parts available, so they don't have to wait for a shipment from the US each time a repair is needed, saving time and money. And we can't assume that our doctors and nurses have used this kind of equipment recently or reliably. So we've developed a training program that's delivered every time one of these guys is installed, that's delivered by locally practicing trainers. So anyone who touches this machine does so safely and comfortably. If one of our products goes down tomorrow, we have the support in place to get it up and running and treating patients, so no one goes without the care when they need it. This technology, this innovation, is a critical piece of the puzzle, but it acts as a platform for building the services that build permanent local capacity. Now, obviously, all of this is incredibly difficult. Delivering safe surgery in a low-resource hospital is a complex, multidimensional problem that technology alone is not going to solve. But that's why there's so much opportunity there. It's often that's what you can't see, the unsexy, that is ripest for you all to tackle. But I promise you it will not bring you glory quickly. Figuring out how to get a device from the R&D lab to the labor ward is not going to make for a good Instagram post. Training doctors and nurses does not trend well on Twitter. We've tried. And repairing that one piece of equipment so it can treat the patients who are depending on it does not land you on the cover of Wired. But we're all here because we see the enormous challenges of our time. And in this era of iPhones and drones, we are inclined to envision change in the form of a product. But all products live in a broader system that demands so much of what you can't see to have the impact anticipated when designing it. And if you can innovate in that space, behind the scenes, immersed in the unsexy, you could just well bridge that elusive gap between a good idea and a great solution. Thank you very much.